So next presentation could be Professor Rajendra. Gupta, do you want to share your slides, please?
Yes. So Paul, firstly, thank you and the Health Data Forum for giving us this opportunity. Though I personally love Portugal, I would have loved to be there. And my favorite bookstore, which is the world's oldest operating bookstore, Birthland, which I visit. I miss not being in Portugal, but hopefully next time I should be there. That's a great place. And I thank the Health Data Forum, the organizers and the sponsors for getting such an eminent panel for discussing one of the biggest challenges of our time. So I'm going to straight away jump into my slide. I just have one slide. So I'm going to talk about not just COVID, but how in the past we have been using data, big data, to save ourselves from similar challenges. So I have this first example of Kenya. This is a very interesting example of how the mobile data was used with 15 million population. Their cell phone calls, their texts were tracked for over a year's time and led to some very interesting findings. And this was done by researchers from Harvard. So when they looked at the data for over a year, they realized that though the vector lives and spreads to only 1 kilometer, but the people actually are much more mobile in Kenya. What was initially thought that this would be like the Lake Victoria and the coastal regions, which are the hotbeds, when they tracked the cell phone data through the towers, they realized that actually it was not the coastal areas. It was just the Lake Victoria region, and the people in Kenya and even people working in Nairobi, the capital, they would go back to their rural areas after work. So they became the super spreaders. So for countries, how data gets important, it is something for us to learn from the past. I'm talking of something that happened close to a decade ago. So just imagine that with this data being available, they were able to exactly focus their resources of what are the hotspots to manage malaria spread. So they could tell people that if you're passing by Lake Victoria, that is the place where you need to use bed nets or, avoid a mosquito bite. So this is where the reality of the scenario is, that at any point in time, it is the data that will be important for us to manage. And this is not just with COVID, it has happened in the past. And I would love to have dwelled in more details with more examples, but I have a limitation that I have just completed a book on digital health, which is going to be launched worldwide by mid-December. So I have a copyright challenge with my publisher not to disclose more of the content till the book is out. So I'm going to touch just briefly. So there is an interesting thing of how people are using data. When you look at certain searches that are happening on certain symptoms, which are matching the spread of a particular disease or an epidemic or a pandemic like this, utilizing data, you can actually figure out if that area is having a similar spread. And this has been tested, validated over years. So there is immense amount of data available, and there are newer dimensions. Like this can come straight away from social media. People who start searching about fever, the cold, and other symptoms associated with the pandemic, you can actually figure out and spot, okay, hey, look, let us research and find out this area at the ground level. Is there something similar happening? So there are various facets and dimensions to how we look at disease. Yes. So, I was talking about the availability and allocating resources through incidents. This has been used in our current even pandemic. Pedro made this very interesting presentation, and if you look at the research collaboration, when the entire world was in a lockdown, it all happened online, digitally. Even the repurposed drugs use data and AI. So I think all of us have seen increasingly how technology has come to our relief during the times of COVID. If you look at Taiwan, this is a place which is like 850,000 people work in mainland China. They have a 23 million population, but what they used was merging the arrivals data, the immigration data with health insurance data, made it available to pharmacies, to hospitals, to healthcare providers. We're not surprised they just had 7 deaths and 530 cases, being still very close to the epicenter. So it was all about data being used to manage COVID. in India, we had 140,000 downloads of Arogya Setu, which was developed specially for COVID. The best part was that it helped us identify 3,000 hotspots. So we were able to warn people. I have an app. When I did this air travel, I need to necessarily show before entering the airport, which says I'm safe to travel. So we have used data, and this data has, I think, been coming handy for us to manage this pandemic. So you can see from my starting of the Kenya, where malaria, right till, people using social media, us identifying where an epidemic or a pandemic is happening or a disease outbreak is happening, to allocating resources. It is all coming to data and collaboration. I think this is COVID has brought forth the reality that existed. We probably looked at not from an emergency perspective. That has brought, I think, world to agree to a point saying that it is a must have. That is what my message was, and I'm happy to be a part of this panel and discuss this further. Thank you, Paul.